Human health and the condition of our planet are inextricably linked. The resources used to better the former compound the stresses upon the latter, thus again impacting the former. It's a downward spiral. Practices, alternative materials, and equipment to more efficiently utilize resources while still allowing progress in delivering better healthcare to more people are sorely needed, and as quickly as possible. While the word conservation often connotes a pulling back, a reduction in what can be offered, my next guests argue that not only can radiology play a large part in both lessening healthcare's impact on our planet and improving the health of all, but that this process can also be a huge boost to a hospital's bottom line. Andrea Rockall is the Clinical Chair of Radiology, Imperial College London, and an honorary consultant radiologist at Imperial College Healthcare NHS Trust. Following a time as a consultant in the healthcare and public sector with McKinsey & Company, Robert Metzger now leads Philips' activities in sustainability, where he drives the company's strategy towards innovative, sustainable business models and embedding sustainable and circular ways of working across the organization. Thank you very much for joining us here at ECR 2024.
Thank you.
Obviously a very important topic. Change in this area within the healthcare sector is multifaceted and difficult. Just both of you start off, if you could start, Andrea, tell us a little bit about how you see possibilities in this field.
Well, we know that climate change is upon us. We can already see it happening here in Europe and across the world. And there are many areas that we can make changes very, very quickly in radiology. Radiology has a reasonably high carbon footprint within healthcare. We have big machinery, we have a lot of computing equipment, a lot of data storage. And if we see the early research that has come out with regards to switching off PACS workstations, for example, or downtime on the large equipment like CT and MRI scanners, significant savings can be made both in carbon and in costs on the electricity costs. And we can see this in the data that's being published now. And I think these are things that are easy to do. Probably most radiologists are working or living in a sustainable way at home. And we need to bring these practices to work and make them possible at work and make them important.
With your past experience, Robert, how do you see the current situation and what are you seeing Philips approaching and in the future able to do in this field?
Let's start with the what do I see in the field? I think there's a raising awareness across the leading care providers in the world. Andrea, you already spoke about it. You published a lot about it. But also the World Health Organization has called out climate change as the biggest health threat to health systems also. And my parents were both over 90. My father passed away recently. But so you see elder people also struggle in the heat waves in the cities where everything is compounded. The health systems that are already under high stress become even more overloaded. So that needs to change. You see a care provider stepping up to that opportunity. Having said that, the question is where to start, right? And maybe we talk about it later on. On the Philips side, of course, we started with our own operations. So since 2020, we are globally carbon neutral in all our facilities. We use 100% renewable electricity, and everything that we've learned there we share with our supply base. We have about 15,000 bill of material suppliers globally, and close to half of them by now have also committed to science-based targets. And we were the first health technology company to commit to science-based targets for scope 1, 2, and 3. So for those that are not familiar with these terms, that means that all emissions, not just from operations, but supply chain and in the use phase, so everything that we bring into the market should not contribute to global warming beyond 1.5 degrees. So there's a lot of stuff that technology manufacturers like Philips can do, investing in eco-design, promoting circular models, reuse, extending life cycle and so forth. But it really is important to team up with the hospitals, with the care providers to really think about what that means practically at the workspace where the clinicians are working and the radiologists.
Yeah.
Exactly so. And Andrea, as somebody actually in the field, both in academia and then also in an institution, the commercial side is sometimes more dynamic. The institutional side can be tougher to change.
Yeah.
What needs to happen? What needs to change?
It can be really tough to change. And even within our own department, where we have quite an active sustainability committee, making that change happen on the shop floor on day to day is, you have to have a lot of push and a lot of resilience to keep going with that change. I might just highlight one project which we achieved through the Sustainability Committee in our department, which is headed up by Sarah Sheard. And the radiographers actually proposed a very good waste management improvement in the department, where we realized that too much waste was going into the sharps bin. And that's a very, very expensive waste stream in terms of carbon and expense to the hospital. And actually, there were very simple changes that could be made to dealing with the contrast bottles, the tubing, and then finally the end bit of the tube, which had to go, only a tiny bit had to go into
Maybe
the sharps bin.
2% of the total.
It was 2%. So 98% of our sharps bin waste decrease, 98% decrease in our sharps bin waste. So those were achievable things actually that anybody in any department can do. But we need to also, there is an education piece that people may not know about the different waste streams and how achievable that is, and the impact on carbon and cost that provided for us in our department. So this was really a fantastic on the shop floor change, but we need to roll that out and really, I think there's a leadership aspect here to say this is important. I think ESR can really take a leadership role here, making it at the high point of the agenda on the education, on the research, on our communication with industry and government. Yeah.
You were also, as a supporter of the organization here through Philips, how do you see it from the side of industry? What can kind of this bridge that is ECR do to better support, implement, facilitate these changes on an overall scale?
I recognize the point that you made, Andrea. So I think it really starts with raising awareness. So that is increasing, but then also helping people in the hospitals, but in the supply chains also to make the transition and make it practical. So where to start? If a hospital decides to do something about carbon emissions and waste and so forth, then you need to understand where the impact really is, right? And then focus on the things that are material. Of course, you can have very long discussions about recyclable coffee mugs, but in the end, an MR scanner on an average basis uses as much as electricity as 26 four-person households. So thinking about and picking people up where they are, right? So thinking about energy-efficient radiology equipment is a very first practical step where the economics and the environmental side come together. I think a next step is thinking about moving to circular models, and we touched on that briefly. So, for instance, expanding the life cycle of this technology with technology maximizers, programs, for instance, or designing them in a different way so that you can exchange components, upgrade them, the software components, and so forth. Not selling imaging equipment, but, for instance, offering imaging as a service so that you can drive maintenance and extend the life cycle, reuse parts. So that's stuff that we do, but I think most interesting in the longer term is, and that's where radiology is so interesting, the radiology department is a centerpiece in many patient journeys. So it really brings a lot of things together. Optimizing clinical care pathways and patient journeys really bring together clinical outcomes and lowering the environmental footprint. And I think this is where the ECR and this community can really take a leading position in driving change towards more sustainable healthcare.
Yeah, I mean, if I can just come back, because sustainable care pathways is the overarching goal. And for example, following the pandemic, when there was a big backlog of diagnostic tests that needed to be done, in the UK and in other countries, there are now the development of these community diagnostic centres, which are being built new. And this is a real opportunity, A, to reduce patient travel to sites, but B, we have an opportunity of designing the diagnostic pathway there in a really clever way, with the equipment, with the buildings, with the lighting, the electricity usage, and all of that. We do have these opportunities in new builds. We have much bigger difficulty. It's very difficult for radiologists to change the structure of the building, and many healthcare situations are in very old buildings with leaky windows and all of that. So there are things that are more difficult for us to achieve, and what I think in the ESR that we can try and highlight and identify are areas with big carbon impacts where we can actually drive the change quickly. The longer term issues, we're very interested in procurement, supply chain, and all of the things with our industry partners. But I definitely think we can make some clear ideas of what can we do that's going to have big impact, like single-use kit and all of that, that we can change on our own, at the beginning.
Andrea, you mentioned the case of the Sharps reduction, efficient utilization of that system. And now you spoke to kind of an overriding desire for change within Philips, and broadly speaking, do you have any examples of possible product lines or processes where you went into it thinking, okay, this is one of our top 3 goals through this development is sustainability, and something to show for that?
Yeah, now, so I always say jokingly, we don't have a sustainability strategy, but we are working on a sustainable strategy. I think that's the difference. So really integrating it. If you are in the healthcare sector, and every doctor takes the pledge to do no harm, you need to understand that it should embrace the planet as well, right? So we have started with eco-design in the 1990s. I joined the company in 2008 with a program that was called EcoVision 4 at the time, where we invested 1 billion euros to mainstream eco-design, first to 25% of global revenues. Now we are beyond 90%, and it has become mandatory. So every single product. So if you ask me for one specific example, I can give you a lot of them. But one of the things that came out of this eco-design program were, for instance, MR scanners that operate helium-free. Right? Normally, an MR scanner uses thousands of liters of helium throughout its life. If you seal the helium chamber, basically, it can operate on 7 liters. You don't need a quench pipe. It is much lighter. It's much so you can bring it also in different places in the hospital. It doesn't need to be in the basement. You don't need to have the exit to the outer wall. So you can optimize patient pathways around this type of technology. Here at the ECR 2024, we are with the first mobile MR scanners that operates without, so it has a sealed blue seal technology. So I think that are really breakthroughs in terms of imaging technology that improve clinical outcomes, reduce scanning time, and at the same time reduce the use of precious resources like helium, for instance.
Helium is one side of it. Just a personal question I have that I've always wondered about, these low helium systems, do they require an additional or supplemental refrigeration? And in so doing, actually consume more energy and electricity scale?
So that is a fantastic question. I think the question behind the question is really the life cycle assessment. So really you need to look at end to end, right? We have
which is what I was trying to get to in my own mind.
I mean, there are lots of discussions around in the car industry, right? How much energy do you need to produce a battery? So I think that's comparable. But if you want to compare that, then you need to take into account the energy that you use to liquefy thousands of liters of helium for the old systems.
It's like a battery.
Exactly. Yeah. So if you take that into account, then of course the performance of the new system is much better. But I think you need to compare apples and apples. Yeah. And helium is running out. I mean, it's a very scarce resource on Earth, and once it's in the atmosphere, it just evaporates into outer space. So it's something also that we should try to contain.
Andrea, from an institutional level, you've spoken about ECR, ESR, and the ability to kind of knock heads together to try and force some change. Are you seeing any changes within your own institutions from a very upper level that in thinking, and then the second part of that question, a change in thinking that's actually affecting change that's actually measurable?
Well, if you mean my own institution, the hospital where I work, yes, or rather an ESR. So the institution where I work, Imperial College, I just want to tell you another story about a fantastic change that we had. We now have in the board a sustainability director, and there's a whole committee around sustainability for Imperial College Healthcare NHS Trust, as well as the university. But in this, there was a project that looked at how many PCs, just the normal PCs that everybody was using around the hospital for all of their records, how many were typically left on for long periods of time without use, and they identified about 30% were not being used for long periods of time. Then they justified bringing in a software to do automatic switch off at 6 p.m. and then switch on at 7 a.m. or whatever. People were leaving computers on because they were told, you must leave them on in case we need to do a cybersecurity patch. Okay, so then all these computers were left on, but they argued, well, we can switch them on centrally using this software. And we'll justify, because we'll save some electricity. And they thought maybe over several years they would justify the cost. But within 1 year, they'd saved £500,000 in electricity costs in 1 year.
Gets the ball rolling.
And that was only doing automated switch off of a number of PCs. We're not talking about the big equipment like the CTs and MRs. We have 3 hospital sites. So it is a large hospital site, but nonetheless. So I think once they can see, as you say, the bottom line coming in, this makes sense. And so we've now got an in-house project on PACS. We're piloting now. We've been measuring all our PACS workstations for a while now, and we're now going to pilot putting the same system on PACS and having like a hot room which will always be open, but then the rest of it will be closed. So, and I think at ESR level, I mean, I'm fortunate. I'm really privileged to be in a position of becoming the president next year, and I'm going to make a big splash about sustainability for sure.
That's fantastic.
Yeah.
During the show this year? Do we get a scoop?
Well, there's more to come. Yeah, watch this space. Watch this space. Yeah.
Robert, back to you. So now we have an example of an institution that's their interest has been piqued. Are you noticing from the side of industry that the playing field is shifting? That I know that Philips, it's not just talk. Philips has been involved in sustainability really for quite a while, in thought, word, and deed. Are you noticing a change, a receptibility to this, what you're offering from institutions?
We do. So here at the ECR, we also engage with a lot of radiologists and ask them where they are, and you see a shift there, right? So last year, for instance, a lot of radiologists told us they are aware that radiology is a big part of the environmental footprint and that they feel increasingly responsible, but many of them still struggled to say, okay, we know where to start, what to do. So this is shifting already. So this year, thanks to efforts like what Andrea was mentioning. So we have been also really engaging with leading care providers around the world to create that awareness, to do scientific studies, really help them understand where the impact is and what they can do. An example is Champalimau Foundation, leading cancer research institute in Portugal, where we have a 5-year contract with them to help them reduce the carbon emissions of radiology with 50% in 5 years' time. Now that has huge implications for how they run things, and it's super exciting and drives a lot of innovation on the ground. We have done a great study with Vanderbilt Hospital in the United States, published at the RSNA. So these findings are accessible also to others, and ECR is a great place for radiologists to engage and really understand what that means, what others are doing, where they can improve, and how that helps them drive better outcomes and lower their cost. So yeah, it's definitely changing.
It's a similar question to you, Andrea, but from the other perspective. With industrial partners, people providing solutions, are you impressed with what they're offering and their ideologies behind it, or do you see a need for a greater investment, a more concentrated effort from that side?
My perspective is that industry are on it. I think, you can see what Philips are doing, and I'm so excited. I'm going to come up and look at that helium-free MR scanner. I want to see that mobile MR scanner. But I think the whole circular economy is developing within industry. I think the contrast agent companies are very interested in what's happening with the contrast in the environment, and solutions to be sure that we're providing only what contrast is needed for patients. I think on the decision support side, I think decision support is really starting to penetrate, roll out now. And I mean, a test that wasn't needed is the most expensive carbon test we can have. If it's the wrong test for the patient, not only is it annoying for the patient experience if they have to then have the right test later on, but it's very carbon intensive. It uses resources that are scarce for healthcare. And I think things like rolling out decision support, getting the right test at the right time, and I think here, raising awareness and educating, what are the simple steps? I was so interested to hear you say that radiologists come and say, we're very aware, but what can we do?
Yep.
And I think that is that's a call for
That's the
us.
hook. Yeah.
That's the call for us to say, okay, these are things we can do now.
Yeah.
Let's think about what we can do in the medium term and what are the long-term strategies and goals that we can achieve, you know? And I think, you know, there's just an industry group, the COSIR group, which are also really have a green strategy, and they're really working on this as an industrial group. So I'm really pleased to see that. Yeah.
I wanted to double down on that, Andrea. So I think Healthcare Without Harm is an NGO, for instance, that does great work in the space. They're also here for people to help them connect peers and radiologists, basically exchange best practices. And it's not a small thing. I wanted to double down on that circularity principle that you mentioned, Andrea. So about 10% of global resources go into the healthcare sector. A very small part of that is ever recycled. If you look at the global scale, then less than 7% of raw materials on Earth are recycled per year, which means 93% are being wasted. So healthcare has a thing to play. At Philips, we have been able to develop capability to take back all large-scale medical equipment by now. So we have refurbishment centers, and people are just not aware of that, right? But if you're a radiologist, think about it. Engage on these discussions with your technology providers also. Are they willing to take back your equipment? Can you exchange them? Can you source in a more sustainable way, right? Can you already, by giving the specifications for what you want to source, be much more clear about the sustainability requirements? I think that really drives change.
And the packaging and the delivery as well of the big kit. You know, these are things like, for us to put sustainability into the procurement questions is really important from our perspective.
Exactly, and that drives change in industry.
Yeah.
I apologize in advance for another question out of personal interest for me. Something I've been considering is, especially with the revolution of AI, we're talking on one side, greater efficiency. We're talking on the other side, massive expenditure of electricity in order to allow this computing capacity. Within to each of you, how does industry see it? How do institutions see it? Is this something that is just by definition AI will be a benefit to the carbon balance, or are there pitfalls, things to avoid, etc.? Please go ahead.
Both, and I think we should be super aware. It's not going to happen by itself. So it's a great question. Thanks, Ben. Maybe to put it in perspective, 30% of all data usage on world comes from healthcare, and more than 90% from radiology, right? So it involves a lot of material, servers, and so forth, a lot of energy. So, for instance, we are teaming up with leading cloud providers also to offer carbon-free cloud storage solutions. So moving things into the cloud in terms of radiology is really important to gain efficiency. Training these large language models is super energy efficient, intensive, and very energy intensive. But this where Andrea also made it earlier, the content. If you can use these AI models, for instance, increase the quality and reliability of the scans. If you can avoid scans, then you basically every scan that you do on top of is just a huge waste of energy. So you really need to use these technologies to optimize care pathways and clinical outcomes and provide better care. And then the positive impact also from environmental side can be massive. But it doesn't happen by itself.
No. I mean, I've been concerned about the impact of training models for some time, and actually
it's the new Bitcoin.
Well, last year we had a session in room A where I challenged a group to talk about what is the impact of training a model, and I got a team from Valencia to look at this, and actually they hadn't thought about it, and then they were astounded when they looked at the carbon impact of training a model. And what I'll tell you what one of my bugbears is. I do research with the engineering department at Imperial, and they're all super bright, wonderful people. And we can come up with clinical ideas, and they can try and, we can find solutions together with this convergent science approach. But sometimes they'll say, okay, we're going to train this, and we're going to try this, and they'll run a model, it'll take a week. And then they'll say, oh, let's just put this into the model. And then the model will run for another week. Yeah. And so I say, look, we need to think of this more like a medical clinical trial where we say, what is our primary objective? What are our secondary objectives? What is our methodology going to be? What is our data going to look like? What is our network plan. Before you run any models, let's imagine the whole pathway and then run the model once or twice, rather than thinking, oh, let's try this and let's try that, because I don't think people are thinking about that. But it's a different scenario when we bring established models into care, where the model's not necessarily being trained. And actually, I wanted to bring to you something that happened yesterday.
Okay.
I was at the AI Theatre in a panel discussion, and the question about cloud came up.
Yep.
And from my perspective, everything's got to go on the cloud. I mean, it's 5 times less carbon intensive, and it's mobile in so many different ways. For example, rather than having 3 different versions of a scan at one hospital, then it was sent to another hospital for an MDT, and then she moved to another place, we have one location for the scan that different hospitals can access through safe pathways. But interestingly, there was big concern in this panel about the cybersecurity side of the cloud. So I think that's maybe something that we need to also consider in the next Congress when we're looking at sustainability and data storage. How can we bear down on data that we don't need, and how can we store it efficiently but also safely?
Absolutely. It's always a concern within healthcare.
It's fantastic to see that the awareness for these topics are rising.
Yeah.
Right. At the same time, it is, I think, irrational to assume that cloud storage would be less secure than storing stuff on old servers on premise.
Yeah, but this is the reality. This is the perception.
Or even worse, back in the day where everything was printed out.
Exactly.
Those things go in the trash, get lost.
Exactly.
Yeah. But people have an idea that if you put patient data onto the cloud, that somehow it's left the environment and the firewall of the hospital, and they feel concerned about that. And I'm not dumbing down, or I'm not criticizing that concern.
No,
it's a real concern. And we need to address it.
And the underlying problem is, or the opportunity also, is that technology is developing so fast. Also on the sustainability side, there are so many new insights, right? So you need to have sufficient time as a professional, as a radiologist, to keep up with all these developments, which comes back to ECR. I think it's a great moment to invest and learn what's available and what's possible.
Yeah,
take a deep breath, look around, and see what everybody else is doing.
And there's so many different strands, There's the big machinery, there's the data, there's the waste, there's the contrast. I mean, there's a lot, and a lot of science going into that as well,
Exactly.
Well, I feel like we could continue this conversation at least for the next hour. There's so much to talk about. It's great to hear from you, Andrea, that this will be something to be focused on. More to come, as you said.
More to come.
And Robert as well, with Philips, once again, as you said, doubling down on sustainability and really driving that issue forward.
Thanks.
Thank you both for joining us here. We're out of time. Enjoy the rest of your day.
That's a
Thank
pleasure.
you, Ben.
Thanks, Ben.
Thank you very much. Thank you.
Bye. Thanks.